Okay. Hello, everybody. So my name's Kelly. Sorry, I'm not the greatest at filming myself, and I actually suck at it. I'll probably mess up every now and then, but I guess that makes it seem more real. So I'll just go ahead and start. So the agency that I chose to do my assessment on was the Cabinet for Health and Family Services, more specifically the Department of Protection and Permanency. Most people kind of know the gist of what it is, but I'm going to go a little bit more in depth about their history and where they came about because I found it actually really interesting and had never looked into it before this assignment, so I thought it would be cool for everyone else to hear. So there are many things that encompass the Cabinet for Health and Family Services. I listed them all there. I won't go through them. You all can, read. But I bolded where it says Department for Community-Based Services because that is part of the umbrella where the protection and permanency aspect comes in. And I've put on my little the resources at the bottom of each slide. Hopefully I didn't forget any. I think I got them all in there, but I will attach to my discussion board post all of the full citations for those. So under the Department for Community-Based Services, as I said, there were a few more things under there. But I bolded the protection and permanency because that's where my practicum agency was located. It was the specialized team. So there are 3 different teams that are involved in each region. And honestly, some regions may have more. This is just my experience with the one that I'm in, which is the Northeastern region. But they have investigative teams in each county, and then they have ongoing teams. The investigative teams do the initial reports of abuse and neglect. They determine whether there was abuse or neglect. And then if the family is determined to need more services or the child was placed in out-of-home care, then they would move on to the ongoing team in that county. And so, like I said, each county has those 2 teams. The specialized team is a regional team that covers 15 counties in the Northeastern region. I could list them all for you, but their central location is around Carter County. I know some of the Lexington students may not be familiar with that area, but some of the bigger cities that you may have heard of that are encompassed in that, or counties that you may have heard of, are Montgomery, Rowan, Carter, Boyd County, Greenup, Flemingsburg. Sorry, I can't list them all because it's hard to list all 15 of them, but so we cover 15 counties, and that's the team that I've been working with throughout my practicum so far. Let me go back and just say that the specialized team actually has specific reports that it takes, and I think I'm getting a little ahead of myself in that that's part of what my local policy is that every region does have a specialized team, and they're sometimes called different things, but they all investigate different things. I believe that Jefferson County has a team that's specifically dedicated to like sex crimes against children, whereas like our specialized team does human trafficking, daycare, schools, other DCBS employees, physical abuse under the age of 5, and foster homes, residential facilities. So not all the acceptance criteria for that team is different in different different regions, but they everywhere has a team that investigates those things. It's a little bit of the background on Child Protective Services. This is what I honestly found one of the most interesting things about this assignment because I just always assumed that CPS existed and that I never thought about what initially jump-started that. So I'm going to kind of skip chunks of time, and so just to get through, because I think it would take me longer than 20 minutes to just talk about all of these things. But so it originally, the need was kind of established in 1875 with, there was a child that was determined to be there was a child that was determined to be neglected and severely abused. Her name was, let's see, I wrote it down in here. Mary Ellen. And I'm sorry, I'm terrible with names, but the woman that actually determined that she was being abused and neglected sought help from ASPCA, the animal cruelty organization, and asked basically what legally she could do about removing that child from her parents' care. They drew up some legal documents, but it was kind of the first of its time in that. So the New York Society for the Prevention of Cruelty to Children was established, just because they decided that, hey, there are no organizations that are protecting children. So they initially started that. Similar organizations and societies were popping up throughout the United States. It wasn't in every state. It was very scattered. So in order to kind of make that more of a cohesive front, in 1912, they established the Federal Children's Bureau, just to kind of give them all somewhere to go, like a central organization to talk with about the issues and how they could solve them. Later on, the Shepard-Towner Act was established between 1921 and 1929, that gave federal dollars to mothers and children. And then later in 1935, the Social Security Act was established or was enacted, and they had some provisions regarding like child abuse, but it was very unclear and didn't actually assign the task of investigating child abuse to any one entity. The article that I found or the book chapter that I found actually quoted to say that the Social Security provision said to cooperate with state and public welfare agencies in establishing, extending, and strengthening, especially in rural areas, child welfare services to provide protection and care of homeless, dependent, and neglected children and children in danger of becoming delinquent. So it didn't really say who was supposed to be doing that, just that it should be done. So in the 1960s, we kind of fast forwarded a little bit of time, but in the 1960s, child abuse became more of a social issue and people were paying attention, and that was because of Henry Kemp and the battered child syndrome, which I'm sure a lot of people have heard of. I actually didn't know the name attached to it, but I definitely heard of the battered child syndrome before. And so him writing that definitely jump-started child abuse and what people needed to be doing about it and how to prevent it, and why isn't there anyone investigating this stuff and making sure that children are being taken care of the way that they should be. So in 1963, doctors and medical staff became required by law to report child abuse, and that was in every state that was enacted, by 1963. And then in 1973, a senator named Walter Mondale brought to everyone's attention that the Social Security Act didn't assign responsibility for child abuse and who was supposed to be regulating that. So they established the Child Abuse Prevention and Treatment Act of 1974. They call it CAPTA, and it gave money so that the state could respond to the abuse and neglect allegations, because they were starting to roll in the millions due to the reporting laws. So honestly, in my practicum, I interviewed the women that I interviewed before I did all this research, because I think it would have been actually interesting to ask them about this, because in my practicum I've heard them use the words CAFTA before, but not in reference to federal money. It's more of in reference to one of the processes that individuals can take in order to overturn their abuse and neglect findings. But this was the first major act that I could find that was related to child abuse prevention. So the mission of DCBS is, well, I'll have it up on the screen. It's, there for you to read. And I will attach my PowerPoint in case anyone wants to go back and read it at their own leisure. But it just kind of wants to reduce poverty and provide family self-sufficiency so that all kids are safe and in a nurturing environment. It also went on to say, because there was a mission and a vision, and I probably should have put the vision in there as well, but it went on to say that federally they were controlling the protection and permanency agency, but then they began doing it more locally. They gave that power to the local communities so that they could work with agencies within their communities and families could work with agencies within their communities. It kind of gave the worker a little bit more freedom in that they want to be able to provide services that are actually helping the families. So I thought that was interesting that they added that in and that was part of their mission. So DCBS is funded by Social Services Block Grant, which actually funds several different things within DCBS. I've listed those for you. And then I also listed the programs that DCBS offers. So a lot of you all, I know, work with younger kids and teens and in that environment. So I'm sure there are some of these things that you've already heard of, but just as a brief rundown of each thing. The Kentucky Safe Infants Act is actually the act that allows you to drop off your newborn within a certain amount of time if you feel that you're not ready to be a parent. It's slipping my mind on what that's called, but that's what that entails. The Independent Living Program is for children that have, or young adults that have aged out of the foster care system so that they can learn how to live on their own independently. Sobriety Treatment and Recovery Team is known as START. And it allows children to stay within their biological homes when their parents are addicted to substances. It allows them to stay in their homes and still be kind of protected. They have people checking in on them every so often, but it allows the parent to get into recovery and work through a recovery plan while still having their child in their care. That way the child doesn't have to go through the out-of-home services. And then the Child and Family Plan is what most people are the most familiar with that DCBS does. It entails all of the abuse neglect reporting and out-of-home services. Whenever a child gets removed from their biological parents, it covers all of those things. And that's kind of what I put on this next slide. It also entails prevention efforts and all kinds of services for the families. And they actually do, which I didn't know, but you can go on DCBS's website and review their state plan every year or every 5 years. But and they actually track their progress in completing their goals on there. So I was actually, for this assignment, able to interview Brittany Davis, which was my practicum supervisor. And she's an FSOS, so I kind of listed the leadership and how things are organized in DCBS because I think it's kind of confusing and it's hard to explain. And rather than saying my boss's boss's boss, this made a little bit more sense. But Brittany is the Family Service and Office Supervisor. Most of the time when people come in, they start as Social Service Worker 1. So she's kind of higher up in the ranking system. Ashley Hawkins, I also interviewed her. I followed her around for a lot of the time within my practicum because she works on Brittany's team, her specialized team, and she is a social service clinician too, so she's just below the FSOS status, which she actually has practiced as an FSOS before, but decided that leadership role just really wasn't for her. So She went with the social service clinician too. So those were the 2 women that I got to interview, and their contact information is listed. So I thought this was an important slide to list, and actually I included it in our Leave Behind paper. I put in there the SLP, which is another policy that I wanted to discuss, and it stands for Standards of Practice. It's basically the state policy on how to handle different scenarios within DCBS and within child protection. But one of the ones that I wanted to focus on that I thought would be beneficial for my classmates is the acceptance criteria, because it lists that on there very clearly, and what is considered to be physical abuse and all the different types of abuse and neglect. And I listed all of the ones on there actually on the slide. But I put the link on the Leave Behind paper, so that way if anyone wanted to go look at that, if you were questioning if something would meet criteria, you can definitely go look at it and see. Or if you're just curious as to what kinds of things meet, maybe you've never heard of that type of neglect before, or if you've never heard of dependency, those kinds of things, you can go on there and kind of see what the state is looking for in reports. I also added, just real quick, I also added on the Leave Behind ways that you can report abuse and neglect of children. I added the phone number, which most people know about. There are more region-specific phone numbers, but the one that I listed will work for any region. And then I also listed the website that you can use, because professionals are able to use the website to report abuse and neglect. Only during business hours, but it is kind of handy, especially with our future career. I think that will come in handy for all of us. So I listed those on there as well. So the federal policy that I wanted to more focus in on and talk about was the Preventing Sex Trafficking and Strengthening Families Act of 2014. I actually have got to work within this policy quite often, because I worked in foster care and in residential, and that kind of targets both of those aspects of child care. But more specifically within that policy, because it's very large and I think it would be very hard to tackle in a 20-minute presentation, is the Reasonable and Prudent Parenting Standard, RPPS. The intention was to give foster parents the authority to make those decisions about their foster child and their participation in extracurricular activities without the need of asking their social worker. Because if you've ever worked in foster care, you know someone that does foster care or any of that, you know that prior to this act, you had to ask the social worker for permission for the child to do basically anything. Join the soccer team, go to a sleepover at a friend's house. Like, it was just every single thing that kid did, they had to have permission to do. So this RPPS standard operates with the idea that our foster parents, or the people that are in charge of these children in out-of-home care, are reasonable and prudent, and they're able to make informed decisions that are rational and age appropriate for each child. So I put some statistics on there of children that leave foster care, and kind of just our foster care system as a whole is a social problem, honestly. There are a lot of issues within it, and the article that I listed kind of links that all back to a lack of social connections, which prior to this, and that's why they say that's why this act was created, because kids were not being socialized the way that they should be. They weren't able to learn and grow as people because they weren't able to go out into the world and be normal. I mean, we kept telling them to be normal, be normal, be normal, but there's no way that your life can be normal if you have to ask to go to a sleepover via email to your social worker. So it kind of attempted to combat that. And let me see what's on my next slide. So when talking with the two women that I interviewed, their major issues with this policy were that there's so much gray area in deciding what these children can do. It's a little bit more difficult looking at the standard, which I probably should have included into it, and I may go ahead and add on to the leave behind assignment just so you can see for yourself. Looking at the standard, it's kind of gray as in what decisions they're able to make, because there are still some things that they're not able to decide. The foster parents can't. Well, I remember being in working in foster care, and there was so much like, so what are they allowed to do? Because there were some times when it was okay for parents to make decisions. For instance, like cutting the child's hair. Like the foster parent couldn't decide if that was okay. It still had to be like going through the parents to decide that. So it had to ask the foster or the social worker first. So it's kind of like those little things that were, is this still okay? Is this something we still need to ask? And things are so bound by like legal issues that no one wanted to mess up. And so no, it wasn't being implemented as it should, because it was still unclear as to what counted under it, because they were saying like social activities. Well, you could pretty much justify anything as a social activity. So it was kind of confusing, and that was like, my practicum instructors like biggest issue with it is there's so much gray area. They leave so much up for the parents to decide, and of course she sees the side that most people don't, most workers don't, in that she's part of the team, although both are part of the team that investigates foster care or foster parents. And so they see what happens when the foster parent makes the wrong decision, so to say. So, maybe that kind of influenced her negative thoughts on it. But generally, it was just a very confusing standard to follow. So I felt like some changes that I felt like needed to be made to it that I think would really enhance the policy are obviously specific definitions on what's covered, because we need to know exactly what's covered. And I kind of felt like that could be done by having like a DCBS social worker come in and do the training for foster parents on this standard, so that they could ask, hey, is this covered? Hey, is this covered? I think that would just be better than having to go through a middleman. But I also felt like mental health screenings for foster parents, I'm honestly kind of shocked that that's not already something that's required, because, as soon as our kids come into foster care, for the most part, a lot of them have to go through mental health screenings. So it's interesting to me that our foster parents don't have that same standard. And I do realize there are pros and cons for each of these things, but I do realize one of the cons is kind of your own personal, like HIPAA violations dealing with mental health screenings. But I feel like the pros of that would kind of outweigh the cons. I think that could help in the matchmaking process, because, just because you're a foster parent, just because you have a foster child, that doesn't mean that you all are a great match. Different people have different personalities, and sometimes they clash. And so, and then also different traumas, sometimes a foster parent that has been through similar trauma as the child might be getting re-traumatized by having them in their home. There are different things to consider. And I think that mental health screenings could really improve that process, could really aid that. So yeah, I think that those two policy changes could really make the policy stronger and make the act more effective and serve its purpose. So sorry, it kind of seems like it ended really abruptly, but those are all my thoughts on the different policies. So my federal policy was the Strengthening Families Act, or the Sex Trafficking and Strengthening Families Act of 2014. My state policy was the Standards of Practice, because they are used statewide. And then the local policies were the policies for the Northeastern Specialized Team, kind of covering like what reports we receive and what reports we don't receive. So if you have any questions, just let me know. Thank you.